Have you heard of amblyopia? Well, check this out, as it can cause your baby to go permanently blind on the one side in an otherwise normal healthy eye. Now that's when you do not notice it early enough. I will teach you what it is and how to get suspicious of it early and what to do about it immediately. I'm Dr. Chris, MD. I'm helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So amblyopia, ambly equals or means dull, and opia means the eye, so it's a dull eye, also called a lazy eye. Now, this is a condition in which the eye and the brain don't work together as they should. So kids who have it will develop good vision in one eye and poor vision in the other. It can make blurry vision, it can cause double vision, and it can harm a child's depth perception, so they don't see in 3D, they don't see three-dimensional. These problems can become permanent if you're not treating it, and eventually the brain will switch off the connection to the lazy eye, which will then be blind or legally blind and never able to see again. So it can be difficult to detect in babies, and even in older kids who often they get used to this vision problem and they might not mention it to the parents or complain about it. Now, as a result, their amblyopia or dull eye might not be diagnosed for months or even years. Now, while the parents chalk up the poor grades and the clumsiness to a child not being academically or athletically gifted, it's not really that, it's the eye. So sometimes the solution is as easy as visiting the eye doctor. Now, treatment for amblyopia can correct the way the eye and the brain work together and strengthen the vision. Okay? Early treatment is important. So waiting or not getting a proper diagnosis could lead to permanent vision loss later on. What happens with amblyopia? Let's see. From birth until about the age of 8, a child's eyes and the brain, they form vital connections. Now, anything that blocks or blurs vision in one or both eyes can slow down or prevent these connections. That's not what we want, that's a bad situation. Now, if that happens, the brain might not fully recognize the images seen by one or both eyes, and then the brain begins to ignore the images seen by the otherwise healthy eye, and the eye becomes weaker, it's losing visual strength or acuity, that's the sharpness with which the eye sees, that goes backwards and backwards, and this eye is then referred to as amblyopic or a dull eye, or a lazy eye. Now, what's causes of amblyopia? One of the most common problems is strabismus. In this condition, one or both eyes, they wander in or out or up or down. It's also called cross-eyed. Now, when eyes don't line up together, the straight or straighter eye becomes more dominant, and the vision strength in the straight eye becomes normal because the eye and the connection to the brain are working normally. The misaligned or weaker eye, though, it doesn't focus properly and the brain ignores the signal, eventually leading to amblyopia or a dullness in that eye. Now, not all kids with amblyopia will have crossed or wandering eyes. In fact, many have eyes that are perfectly straight. Okay? If so, amblyopia might be due to an anatomical or a structural problem that interferes with or that blocks the vision, such as, for instance, a droopy eyelid. Now that eye doesn't see much and the brain switches it off, or a cataract, which is an opacity or a dullness inside the lens in the eye for other reasons. Now, other causes of amblyopia are severe farsightedness, hyperopia, or severe nearsightedness, myopia, or astigmatism, a form of blurry vision where the cornea is not completely smooth and it wobbles or warps, and then the picture you see is bad. Now, these problems make vision blurry, and it's these blurry images that are sent to the brain. Now, over time, the brain begins to ignore these images, resulting in amblyopia in one or both eyes. Sometimes having different vision strength in each eye, known as anisometropia or asymmetrical vision, it can cause amblyopia. Now, when one eye sees more clearly than the other, the brain ignores the blurry eye, and genetics can play a role too, so sometimes amblyopia tends to run in families. It's also more common in children born prematurely or those with developmental delays. Please subscribe and click like if you're getting value from this video, and then YouTube will show it to more people like you that can make use of it and benefit from it. What makes us suspicious of amblyopia? Well, you might realize that your baby is struggling with a vision problem. Why? Maybe noticing crossed eyes or frequent squinting, they go like this, or tilting of the head to see better. Some kids have poor depth perception and then trouble seeing in 3 dimensions with clumsiness and poor coordination, and missing to grab things or missing to catch things. So most children with amblyopia, they won't complain of vision problems. They're too small. Over time, they become used to having good vision in one eye and poor vision in the other. They have no reference to compare this with, so they think that's normal. Now, regular vision screening by healthcare providers are an important part of finding any problems in the kids. Now, routine eye exams, the screen exams, what do we do there? Kids get their first eye exam in the hospital as newborns before they even leave the hospital after birth. Then a doctor or nurse will check their eyes at each wellness baby checkup, where you follow up 2 weeks, 1 month, 2 months, 3 months, 6 months, 9 months, 12 months, and so on. For kids in school, the nurse often does this too. Now, depending on the child's age and the family health history, each eye exam may be slightly different. Eye exams can include vision or the eye checking or vision screening to check the overall health of the eyes, or visual acuity testing to find out how sharp or clear the objects appear to the person, and then also eye alignment to see how well the eyes work together. Now, if the pediatrician or the family doctor finds a problem that needs to be checked, by an eye doctor, they will recommend that your child see an ophthalmologist or an optometrist. These are the eye guys or the eye specialists. Now, our eyes help us take in the world around us and play an important role in kids' development. So getting regular eye exams can keep the eyes healthy or make sure that they're healthy and discover any vision problems early. So many problems and eye diseases can be treated, especially when they're found early. So when should I see the doctor? Many vision problems that are found early can be corrected. Just understand that. That's a very important point. So call your pediatrician or your family doctor if you notice that your baby's eyes are any of these. They're often red, or they look different than usual, or they make tears more than usual, or they don't line up or move together, or they look crossed after 6 months of age. Remember, babies, when he's 2 or 3 months old, they look at everything close up and then it looks like he's squinting, but he's not. Or sometimes if you have pupils, the centers that are different in size and are unusual color or have change in color. Also call if your child complains of eye discomfort, or they rub the eyes a lot, or it seems very sensitive to light, or has trouble focusing on or following an object. Now, in school-age children, signs of problems can include not being able to see objects at a distance, or trouble reading from the blackboard or the television screen, or from the computer screen or the tablet, or they're squinting like this, they're squinting the eyes, or they have trouble reading, they just don't read well for no apparent reason, or they're sitting too close to their monitors or the TV, or they have headaches. So, how are you enjoying your baby? Do you have any challenges? Comment below and I'll make more videos. Just tell me what you'd like to see. This is Dr. Chris signing off. Ciao, mamas. Thanks for watching.